Welcome back to Roadmap to Residency. In this video, we are focusing on test day strategy and final tips for the Step 2 Clinical Knowledge exam. We are not going to reteach medicine here. Instead, we are going to sharpen how you attack questions, manage your time, handle the questions you are unsure about, and understand how the exam itself is built. Think of this as the layer that sits on top of all the content you have already studied in your review books and your question bank. The students who improve their scores at the end are usually not the ones who learned one more disease. They are the ones who stopped losing points to avoidable timing and strategy mistakes. Let us get into it. Here is what we are going to cover. First, time management and pacing, so you finish every block with time to spare and never leave free points on the table. Second, handling uncertainty, because every single person who takes this exam will hit questions they are not sure about, and how you respond decides whether you bleed points or contain the damage. Third, insights into how the exam is actually built and scored, which changes how you should think about the hard questions. And finally, your plan for after the test, both right after you submit and while you wait for your score. Remember, the content comes from your review books and your question bank. What we add today is strategy. Let us start with pacing, because time is the resource almost everyone underestimates. Each block gives you roughly 1.5 minutes per question. That sounds like plenty until you hit a long clinical vignette with a chart and a set of labs. The single best habit you can build is checking the clock at predictable points, for example at the 1/4 mark, and again at the halfway mark of each block. If you are only on question 15 of 40 when half your time is gone, that is your signal to pick up the pace right now, not at the end. The second rule is just as important. Make one pass through the block and never freeze on a single question. If something is dragging, choose your best answer, mark it for review, and move on. A blank answer earns you nothing, but a reasoned guess gives you a real shot. The easy points are scattered all the way through the block, including at the very end, so do not let one hard question early on rob you of 3 easy ones later. Now, handling uncertainty. This is the skill that separates a good score from a great one, because everyone meets questions they cannot answer with confidence. The first move is to flip your mindset. Instead of hunting for the perfect answer, hunt for the wrong ones. Use the strike-through tool to cross off any choice you know is false. If you can eliminate even 2 options, you have turned a wild guess into roughly a coin flip, and over a whole exam that adds up to real points. Be especially careful with answer choices that are completely true statements but do not actually answer the question that was asked. Those are some of the most common traps. Once you have narrowed things down, trust your first instinct and commit. Research and experience both show that changing answers tends to hurt more than it helps, unless you genuinely misread the question or spot a clear error. So make your choice, flag it for review if you want to revisit it, and move on with a clear head. And remember, every question is worth exactly the same. Do not let one brutal question shake your confidence for the 10 that follow. Now let us talk about how to actually read a question stem efficiently, because most vignettes on this exam are long and full of detail designed to slow you down. Here are 3 techniques your question bank rewards. First, read the last line first. Before you wade into the paragraph, jump to the final sentence and find out exactly what they are asking. Are they after a diagnosis, the next best step in management, the mechanism, or the most likely complication? Knowing the target up front means you read the story looking for specific information instead of trying to absorb everything. Second, hunt for the buzzwords. Every vignette plants a handful of details that actually decide the answer, things like the patient age, the timing of symptoms, a single lab value, or one classic descriptive phrase. The rest is often filler meant to bury those clues. Train your eye to lock onto the signal and skim the noise. Third, predict before you look. Once you have read the stem, answer the question in your own head before you glance at the choices. If your prediction is sitting right there in the options, pick it and trust it. This habit protects you from the well-crafted wrong answers that are designed to sound tempting. Let us put these strategies to work with our first practice question. Notice how we read it. Jump to the last line first. The question asks for the most appropriate next step in management. That is our target. Now read the story with that in mind. A 62-year-old man with high blood pressure and diabetes comes in for a routine visit. He feels completely well. His blood pressure today is 152/94, which is above goal. especially for a patient with diabetes. He is already on a moderate dose of a single blood pressure medicine, and his kidney function and potassium are normal. The buzzwords here are that he is already on one medicine, his pressure is still above target, and his labs are clean. Make your prediction before you look at the choices. Then we will walk through why each option is right or wrong on the next slide. Take a moment to commit to an answer. Let us walk through it. Step 1. Spot the pattern. This patient has high blood pressure that is still above goal even though he is already on one medicine, his labs are clean, and he has no symptoms. Reading the last line told us the target is the next step in management. Step 2. Apply the rule. On the boards, when a patient remains above their blood pressure goal on a reasonable dose of a single agent, the standard next move is to add a second medicine from a different class. The fact that he has diabetes only raises the stakes for getting that pressure controlled. Step 3. Eliminate the wrong answers, and this is where the trap lives. Choice A, reassure and recheck in a year, is wrong because his pressure is above goal right now and delaying is harmful. Choice C, kidney artery imaging, is chasing a rare secondary cause with nothing in the stem to justify it. Choice D, starting a medicine for erectile dysfunction, is the classic two-step trap. It is a perfectly real treatment, but the patient never mentioned that problem, so it is a true statement that does not answer the question being asked. That leaves choice B, add a second blood pressure medicine, as the correct answer. The lesson is to answer the question they actually asked, not a question that simply sounds plausible. Here is our second practice question, and this one is built to show you how elimination saves you when you are unsure. A 45-year-old woman has felt tired and cold for months, with dry skin and a slow heart rate. Picture a classic underactive thyroid. The question asks for the most appropriate initial laboratory test. Suppose you cannot instantly recall the single best first test. This is exactly the moment to switch from finding the right answer to removing the wrong ones. Look at the 4 choices and ask which ones do not fit an initial screening test for an underactive thyroid. Cross off anything that is clearly an imaging study or an invasive procedure rather than a simple blood test you would order first. Make your prediction, eliminate what you can, and commit to your best remaining choice. We will walk through the reasoning on the next slide. Let us walk through the reasoning because the point of this question is the method, not the trivia. Start by crossing off the wrong choices. Choice B, a thyroid ultrasound only shows the structure of the gland, not how well it is working, so it cannot confirm an underactive thyroid. Cross it off. Choice C, a radioactive iodine uptake scan, is a test you reach for when a gland is overactive, which is the opposite of this patient. Cross it off. Choice D, a fine needle aspiration biopsy, is invasive and is used to evaluate a thyroid nodule, not to screen for low thyroid function. Cross it off too. Notice what just happened. Without recalling a single fact, you eliminated 3 options, and that leaves choice A, the thyroid-stimulating hormone level, which is exactly the simple first blood test for a suspected underactive thyroid. The correct answer is choice A. The lesson is that when memory fails you, structured elimination will often carry you to the right answer anyway. Narrow the field, commit to the best survivor, and move on. Let us talk about how this exam is actually built, because understanding the structure changes how you should behave during the test. The Step 2 clinical knowledge exam uses a fixed form within each block. It is not adaptive in the question-by-question sense, where the test gets harder every time you answer correctly. So if you hit a brutal question, do not panic and think you must be doing badly. A hard question is just a hard question, not a verdict on your performance. Here is what the structure does mean for your strategy. Within a single block, you have complete freedom. You can move forward and backward, change your answers, and revisit anything you flagged. But the moment you end a block, it locks permanently and you cannot go back, so always use your review time before you close a block. There is no penalty for guessing, which means leaving a question blank is simply throwing away a chance at points. Always put down an answer, and keep in mind that some questions are unscored experimental items seeded into the exam. You will never know which ones, and that is one more reason to never let a single impossible question wreck your focus. Answer it, flag it, and move on. Here is our third practice question, and it shows off the most common question format on this exam, the next best step in management. Read the last line first. They want the next best step. Now the story. A 55-year-old man comes to the emergency department with crushing chest pain that started an hour ago and radiates to his left arm. He is sweaty and short of breath, and his heart tracing shows changes pointing to an active heart attack involving the lower wall of the heart. He has already received aspirin, and his vital signs are stable. The buzzwords are unmistakable: an active heart attack with tracing changes, occurring within the last hour. Predict your answer before you read the options. When you see a next best step question, ask yourself what action changes this patient outcome right now. Take a moment, commit to your choice, and we will walk through why one answer clearly wins on the next slide. Let us walk through it. First, spot the classic pattern. We have an active heart attack with clear tracing changes that began within the last hour, and the patient already has aspirin on board. In a heart attack, the saying to remember is that time is heart muscle. Every minute of delay means more permanent damage, so the single most valuable next step is to restore blood flow by opening the blocked artery as quickly as possible. That points us straight to choice B, the urgent procedure to open the artery. Now know the key distinction by eliminating the rest. Choice A, a treadmill stress test, is actually dangerous in someone having an active heart attack, so it is not just wrong, it is harmful. Choice C, repeating the heart tracing in 6 hours, throws away precious time when the diagnosis is already obvious in front of you. Choice D, discharging the patient, is clearly unsafe. Notice the common thread. Every wrong answer delays the one action that protects the heart. The correct answer is choice B. For next best step questions, always ask which choice changes the patient outcome right now, and beware of options that simply delay the inevitable. Now let us talk about your plan for after the exam, because what you do once you submit matters more than people think. First, right after you submit. The moment you finish, you are truly done, and there is nothing more you can do, so let it go. The single biggest mistake students make is rushing home to look up the answers they think they remember. Your memory of the exact wording is unreliable, and you will often misremember what was actually asked, so all that does is create needless anxiety. Instead, get a good meal, rest, and step completely out of study mode. And please resist comparing notes with classmates, because everyone sees a different mix of questions, so those comparisons tell you nothing useful. Second, while you wait for your score. Results usually take a few weeks to arrive, so plan something to fill that time. Here is something important to hear. Walking out feeling like you failed is incredibly common, even among students who end up passing comfortably. That feeling is not a prediction, so do not give it any weight. Use the waiting period productively by moving your residency application forward, requesting your letters, and polishing your personal statement. And if you want experienced guidance on those next steps, this is exactly where our tutors and advisors can help. Let us bring it all together. The strategies we covered today, pacing your block, handling uncertainty through elimination, reading the question stem efficiently, understanding how the exam is scored, and planning for after the test, only work when they sit on top of real knowledge. So learn the material through your review books and your question bank, and treat every single practice question as a rehearsal for these habits. Practice your pacing, practice eliminating wrong answers, and practice reading the last line first until all of it feels automatic on exam day. If this video helped you, please like and subscribe so that more students can find it. And if you want personal guidance, head over to roadmaptoresidency.com, where our expert tutors and residency advisors can work with you one-on-one, not just for this exam, but for your entire residency application. Thank you so much for watching. Trust your preparation, stay calm, and go earn the score you have worked so hard for. Good luck on test day.